When it comes to knee problems, a problem that some people have is a problem with their cartilage, and whether they're a young active patient with a small cartilage defect, we have different options to perform surgery on that, and it would be advanced cartilage restoration, and that's one of my specialties. And our ultimate goal is to get those patients back to an active lifestyle doing what they love. So we have different options, one being microfracture, which is taking holes and poking it into the bone where the cartilage can regrow. A second is autologous chondrocyte implantation, which is often referred to as ACI, and that's a two-stage procedure in which the first stage, the cartilage is biopsied and then sent to a lab where it is grown and increased in number, and then the second procedure is where it's reimplanted into the knee. There's also more newer types of procedures such as DeNovo, which is juvenile cartilage that can be implemented into your knee into a one-stage process. Also OATS, which is osteochondral transfer system, in which we can take cartilage that's less needed in other parts of your knee and use it for the defect area. So ultimately, all these things are trying to get you back to being active, and it's evaluation in which we take a look at your knee, we look at your specific findings on both physical exam and imaging to see what might be necessary for your knee problem.